What is your wife's name?
My name is Sylvia.
Uh-huh. And you have, how many children do you have?
Daniel Emplaeo is only 42. Coming back from the massive stroke that almost killed him is a painful and heroic struggle for this former bus driver.
Yeah. So Daniel, can you tell us your name today? Tell us your whole name.
Whole name is
Mr. Emplaeo has 2 teenage children and a new baby. Now he's paralyzed on his right side, can barely speak, and is often confused.
He's saying he is having a headache, and I never thought, I don't have any idea. I thought it's just, an ordinary headache.
2 days before he collapsed, he complained of some blurriness in his eyes, but the symptoms passed, so he went to work.
On the Sunday, he's complaining a little bit on a little blurry in his eye. Following day, it's Monday, it's his day off. And in the afternoon, he go into our backyard. He water the plants. I noticed that he's trying to lift his leg, but it seems he can't lift it. He cannot talk already, and he can't move his other part of the body already. So that's the time I called 911. I was so afraid because 2 years ago, his father died because of stroke.
Mr. Emplaeo was at high risk for a stroke, but like so many of us, didn't recognize or pay attention to the warning signs. It was the same for Sylvia Saxon. Despite having high blood pressure, diabetes, and a family history, her stroke came as a surprise.
When my foot went to sleep, I hadn't thought it could be a stroke. I thought it was just when you're sitting down or laying down like you do and your foot go to sleep. I did not really connect it to the signs of a stroke.
Luckily for her husband, Robert, Alma Shanley did connect his symptoms with the fact that he was having a stroke.
He sat down in the chair and he kept staring at me, and I thought he was fooling around with me at first. And I said to him, "This is not funny, Robert."
I could not speak. All I knew, she was my wife, and I reached over and took her hand, and then I couldn't remember the names of my grandchildren or my daughters. It was a complete blank.
And I said to him, "You're having a stroke. Stay here. I'm calling the doctor. I'm calling the ambulance."
Unlike a heart attack where people develop crushing pain, oftentimes when a person has a stroke, there's no pain at all. What happens is they lose function.
Quickly recognizing the signs of a stroke is key to surviving a stroke. And the signs can be subtle, like Sylvia Saxon's when her foot suddenly went to sleep, or more profound, like Robert Shanley's when he suddenly couldn't speak. What is consistent is that the symptoms occur suddenly.
Examining him, Dr. Richardson.
Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion or trouble speaking. Sudden trouble seeing. Sudden trouble walking, dizziness, loss of balance, or coordination. Sudden severe headache with no known cause. While knowing the warning signs of a stroke is crucial, knowing if you are at risk for a stroke is equally vital.
Some of the risk factors for stroke are hypertension,
diabetes, high cholesterol,
obesity, physical inactivity,
cigarette smoking,
in some cases obstructive sleep apnea,
a genetic background for stroke.
African Americans and Hispanics have a higher risk of stroke, and we don't exactly know why that is.
There are many factors that will increase a patient's risk for stroke. Primarily among those is hypertension. Second, hypertension. Third, hypertension. Hypertension is a silent killer. I describe it as driving with one foot on the gas and one foot on the brake. Your car runs beautifully. You don't even really notice it. But what happens? You burn the engine, you burn out the brakes much sooner than they normally would. And that's exactly what happens with hypertension. It's slowly wearing out your organs. Your brain, your blood vessels, your heart, your kidneys. and you're not aware of it until you have a serious event.
Even when people know they are at high risk for stroke, and even when they know the warning signs, too often when something terrible happens, they still don't connect the dots.
I'm a stroke survivor. At age 31, I had a very sudden, severe headache, nausea, and became very gawky. Despite many years of training and experience as a physician, I went to bed. I'm going to sleep it off. An hour later, I got up and walked into a wall, missed the doorway. My wife said, "I'm taking you to the hospital." She drove me to the hospital. Now, I did very well. I'm very, very lucky. But there were two mistakes. One, I went to sleep. Two, she drove me. She should have called 911.
What's our ETA, bud? ETA to Alta Bates?
5 minutes, please.
5 minutes.
What are the signs and symptoms of a stroke? They include weakness on one side, trouble speaking, trouble seeing, trouble walking. Any and all occur suddenly and might only last for a moment. What are the major risk factors for a stroke? Having high blood pressure, being overweight, being a minority, being a woman on hormone replacement therapy, being a smoker. What should you do if you think a person is having a stroke? Act fast. Do this simple test. Ask the person to smile.
Does one side of the face droop?
Ask the person to raise both arms.
Does one arm drift downward?
Ask the person to repeat a simple sentence.
Are the words slurred? Can they repeat the sentence correctly?
Call 911.
Time is important because brain cells are dying.